Welcome to 30 Days of Health and Hope. So, this is Dr. Susan Lavelle, and today we're going to be talking about supplements. Now, I know in the past, there's always been this push and pull between should I take supplements, should I not? And now, even more than ever with COVID-19, there is a lot of concern about some of the supplements we're taking and some of the ones that we're not. And so, we're going to go through some of that today and kind of bust some of the myths that are out there. As with anything else, I want to make sure that you're aware that none of these statements have been investigated by the Food and Drug Administration, and therefore they're not intended to diagnose, treat, or anything, any condition or illness. So just be aware of that. Now, all of that being said, let's go into some specific things. What are the things that we can do to boost our immune system? And so, of course, the number one thing that we want to do is to eat and take care of ourselves first, to take care of ourselves best. So that means eating elite. It means moving more, living wisely, and loving divinely. So when we do these things, when we take care of ourselves and are proactive with our own health, then absolutely our immune system is going to be stronger. And I've done many talks about this recently about how important it is for us to take back control of what we're doing. However, what if we're not eating the way that we should? Are there some supplements that we can use specifically now that will increase our immune status? And I'm going to say, yes, there are, absolutely. So let's just go into some of them and what each one of them may do. And I do have some notes here because I don't want to leave any out that are some of the big ones. So very first, we have our vitamin C. That's a long-standing thing, and it's an old standby. If you think back to the sailors, back in old times, and they didn't get any fresh fruits, they were the ones who developed scurvy. And so we know that vitamin C has a significant use, and it also has a thing that it develops into if you don't have enough of it. But what does vitamin C do for us as far as the immune system is concerned? It actually increases the action of our white blood cells. Now, these white blood cells are the cells that are used to, they are our immunity. They're a big part of what our immune system is all about. And they have different jobs. Sometimes they're there to just kind of gobble up the infection. Sometimes they're there to almost act like a bleach for infection or things. So there are various things that they do, and one thing that vitamin C does, it actually boosts the immune system by boosting our white blood cells. Another thing it does is it acts as an antioxidant. And that's another word you may hear a lot of out there, antioxidants and taking them. But what is it all about? The body makes, when there's any kind of stress, and stress can be, yes, external from something like an infection, like what we're all concerned about right now, but it also, the body itself goes through stress just by the activity of living, of daily living. And so we make substances that can actually harm us in the long run. And so there are antioxidants that will take the oxidants away, and vitamin C is one of them. So it actually has a very long and well understood action as an antioxidant. Now, there's a third thing that it can do, and hopefully we will not come to this area, but we'll talk about it anyway. In high doses, in an intensive care unit, what high doses of IV vitamin C can do can actually help the patient, the intensive care unit patient, recover faster. So those are three things that vitamin C does that is all related to our immune system. Let's talk about quercetin. Now, quercetin you may not be as familiar with, and that's actually a bioflavonoid, and it works hand in hand with vitamin C. And so if you are going to take the quercetin, it's very good to take it with vitamin C together because they increase absorbability, they increase the amount that they actually work. So that's a good thing to do. It does have some antiviral activity. Zinc. I've been speaking about zinc recently, and what zinc does for us, it improves our intestinal, how strong our intestines are with respect to our immune status. So and actually some interesting information just came out. So we know that the COVID virus actually kind of sits into our lungs. That's where it does a lot of the damage that we're aware of. But what's just now coming out is that even though the gastrointestinal tract symptoms there aren't as prevalent, when you do have those symptoms, it's actually even more significant, and you would have a rougher course of the coronavirus. Okay, so the zinc is actually going to improve the way our immune system works in our gut, because our guts are actually the first line of defense. You know, when we eat something, when something comes into our body that way, that the gut lining is what protects us from that infection. So zinc is critically important. Vitamin D. Now, this is one of the vitamins that's really kind of controversial. Vitamin D is, vitamin A is, and the reason for there are several reasons, and one of them is that they are fat soluble. So if you take too much of them, you can actually overload and overdose on them. So you want to make sure that you're not taking too much of them. However, there's also concern because both vitamin A and D work with the immune system. If maybe perhaps if you're increasing them, that you might be kind of shoving the immune system in the wrong direction. Is another thing that we also can take, which is called elderberry syrup, and you may be familiar with that. And you may have heard about the cytokine storm, which is something where the white blood cells and things just kind of go totally off the charts in how they react. And that's what's going on in people who are having those severe lung issues. There's a cytokine storm. And so there has been concern that perhaps by boosting the immune system too much, that you might kick it over into the other direction. And that's why I'm saying whatever you're taking, make sure that you know what your levels are. So especially with something like vitamin D, make sure you know what your levels are and go from there. Now, I won't give specific numbers, but you want to make sure that you're not below 30 to 40. And the reason for that is below that, your immune system really doesn't work well. Funny thing about vitamin D, though, is when you're on the other end and you're too high, it also can kind of lower your immune system. So there's really kind of a sweet spot for vitamin D. You really want to be careful about that one. What else do we have? Vitamin A, which modulates gut bacteria. Now, that's another one of those fat-soluble vitamins, and so you want to make sure you're not taking too much of those. We have the B vitamins like B6, folate, and B12. Each one of those is critical just for the way the body works, the way the whole, all of the actions, the normal everyday actions of the body. And so if we're low in any of them, we're not going to function as well as we should. But when we're concerned about our immune status, each one of those has a separate role as well. So B6 can increase the white blood cell maturation. We want mature white blood cells so that they can do the job they're meant to do. Some of them, as I mentioned, are there to chew up. Some of them are meant to just kind of kill the cells, the invaders. So we want them to be mature enough to do what they're supposed to do. Folate does the same thing. It helps the body's own defenses. Now, B12, on the other hand, increases the number of these fighter cells so that, when the virus comes or whatever infection comes, we've got enough to actually get out there and fight for us. And then finally, I want to talk about magnesium. And magnesium is not necessarily as connected with our immune system, but it is critical for so many of the actions, again, that our body does, all of the bodily functions that we have, for digestion, for mood, for your thyroid. It's just so many things. We want to make sure that our magnesium levels are appropriate. And that is actually one of the things that tends to be on the low side, especially here in America. We tend to have lower magnesium levels in general. So that would be another thing that you would want to kind of keep track of. I did mention yesterday about melatonin, and melatonin, other than sleep, does have something to do with your immune system as well. So you want to keep an eye on that as well. So those are the ones that I wanted to talk about today, as far as supplements that you may want to be taking. I do want to talk about something else, though, and there's another big controversy out there, again, about which one you should take and which one not. And it's ibuprofen versus something like acetaminophen or Tylenol, something like that. And there are some who are saying that ibuprofen is more likely to cause a cytokine storm and therefore take Tylenol. Well, I'm here to say You really, if you can avoid it, you don't want to take either. And the reason for that is that both of these are medications that work against your gut and work against your gut lining. And remember what I said, your gut lining is the very first line of defense for any invader coming into the GI system. So if you're taking a medication, whether it's ibuprofen or Tylenol, then you're actually lowering your immune system within the gut itself. So what do you do if you have a fever? That's usually why people take it, either fever or pain. The answer is to go back to grandma's things where we would actually, get in a tepid bath, or kind of put the cool compresses on. Lower our fever that way. The body has a fever because it needs that. It's trying to burn up the invader, literally. And so if we take that away, we are literally taking away one of the defenses that the body has. So that's what I've got for today. The supplements that may help and probably would help. The fact that we want to stay away from both Tylenol and ibuprofen if we can. But the most important thing is that you want to heal from yourself, from the inside. So the things that you're putting in, the rest that you're getting, as I said yesterday, the unsexy stuff, just taking care of your body and being proactive that way. Those are the best ways that we can go forward and heal. Okay, that's it for today. Thanks. Bye-bye.